So this is re.flex. The patient has a username and login, and there's a nice simple user interface, and it's really easy to use even for those who are not so tech savvy. re.flex then takes you through the calibration process. To connect the sensors, they're placed one above the knee and one below, but this doesn't need to be specific, just tight enough so that they don't slip down whilst exercising. And for hip and knee patients, the sensors are placed in the same place for both. The sensors are connected one at a time and connect via Bluetooth. You can see here when not training or whilst initialising the sensors, the patient and physio can review the previous days or weeks and then also see the days or weeks ahead for their training programme. Both the physio and the patient can see their training schedule each day and how much they've completed. There's a database of over 80 exercises which have all been chosen due to their evidence base. For those with hip conditions or post-op restrictions, you don't need to bend greater than 90 degrees to calibrate. It's a simple process as well, which gets easier the more you do it.
Keep your knee straight, then press the button. 3, 2, 1. It's your turn now.
To calibrate the sensors, the patient flexes their hip as shown. This again gets easier as patients get used to it, and this can be completed in lying or standing depending on the exercise.
Well done. Hip flexion standing. 1.
The sensors measure range of movement accurately and within 4% of the Vicon system, which is known as the gold standard. As you move, the avatar mirrors your movement and corrects form as needed.
3.
The patient can adjust speed and skip exercises, and with some of our protocols they can even choose an easier or harder setting.
5. Exercise almost finished.
The patient is also encouraged to strengthen the unaffected leg as appropriate. A visual analog scale is taken at the end of each exercise to monitor pain levels. This data is stored, and again the physio can see this in real time. Patients really like this because they can monitor their progress over time, and physios can use this for proms and prems.
1, 2, 3. Exercise almost finished. Exercise finished. 1, 2, 3. Exercise almost finished. Exercise finished. 1, 2, 3, 4, 5. Exercise almost finished. Exercise finished. Exercise paused. 1, 2, 3. Exercise almost finished. Exercise finished. 5 more seconds. 1. Exercise paused. Keep your dial lower. Keep your dial higher. 5 more seconds. 5 more seconds. 1. 5 more seconds. 2. Exercise almost finished. Exercise finished. 1, 2, 3, 4. Exercise paused.
At the end of the day, the patient can go back and finish any exercises that they haven't completed yet, or if they log in and out, they can complete another set. re.flex will record any extra training they do. Both the physio and patient can see each day how much has been done. An email with the dataset can then be sent to consultants or clinicians for their records. re.flex has a text messaging system which allows the patient and the physio to communicate regularly.